I came into dentistry as one of very few behavioral scientists, a psychologist, and kept getting the question, what are you doing in a dental school? But I did find myself moving through leadership roles in higher education, starting at the dental school in Buffalo, going to Colorado first as vice president, and then being selected as president of the University of Colorado, the first woman president, I might add. And as I moved through those roles, I realized how few of us are fully prepared to take on major leadership roles.
As a senior consultant, she works with dental schools and other institutions on projects like strategic planning to help them think about, envision the future, and then develop an actionable plan to achieve that future. She's such a visionary, and she's able to bring that vision and that passion to those she works with as a consultant.
Because Judith has some unique skills that are very rare in any community, where you take a researcher and combine it with executive management talent. We look to Judith Albino to help us co-lead an effort to look at oral health in America. Have we made any progress?
My colleague, Dr. Bruce Dye, and I were co-editors of the 20-year update to the Surgeon General's report of 2000.
And together, they were able to co-opt many researchers, hundreds of researchers, and then produced a report that we now call Oral Health in America.
But we discovered that a lot has changed. We've dramatically improved access to dentistry and oral health services for children, not so for adults. Dentistry is still extremely expensive. And as we know, dentistry is still not covered by Medicare. And so older adults are struggling to get the oral health care that they need.
It conveys to the public the importance of oral health to general health. It's much clearer to everybody why oral health has to be integrated into primary health care, why oral health professional education has to be interprofessional health education.
Dr. Albino is an authentic leader, and she has always empowered everybody around her. When I was a junior faculty at University of Colorado, she would always ask me about my opinion and my perceptions, and that made me feel that my opinions mattered. It helped empowered my own thought process.
Dr. Albino's influence has been nationwide. She was the principal investigator for the only NIDCR Center for Native Oral Health.
We were in those communities for about 10 years. We had one simple rule that we would hire all the people who were working in the community. They were all from the community and they were Native. So that really helped with trust building.
The whole context of a person's life comes to play when they have threats to their health. But we also learned you don't address oral health issues as an isolated problem. Every tribal community will have its own concerns and its own needs and its own way of working with problems. But we could not design a program to address those issues unless we worked with the people and understood how they saw these problems and how they were comfortable in addressing them.
But what I see in Dr. Albino is this selflessness and a focus on the welfare of others, on the well-being of others.
She means the world to a lot of people. She has impacted the lives of so many people.
Judith Albino exemplifies one of the best characteristics of the William J. Gies Award, in that she truly is an interdisciplinary leader. And that's futuristic in my mind. I'm thinking ahead of what kind of leader will be necessary for not only dental education, but the practice of dentistry, oral health of the American people, and of the people of the world. William J. Gies would have been proud of that selection.
There's an adage that says something like, smooth seas don't make good sailors. And I know that Dr. Albino hasn't always had smooth seas, but I've certainly watched her persevere, and I've appreciated her resilience. And as a part of that, her courage.
I hope that my impact has been through helping people to see that no matter how good our techniques, no matter what we learn in terms of the science and the technology, if we don't understand people, we can't provide good health care. There's just nothing that I could consider more wonderful than being recognized at this point in my career with this award.
Judith, congratulations on this Gies Award.
On behalf of my community and the behavioral epidemiology and social science research community, we all wish Judith all the best going forward, and our warmest congratulations.
So well deserved. Thank you so much for your influence, your impact, the way that you've changed me personally and countless others.